Hi, everyone. My name is Matthew Kurian. I am a medical oncologist at St. Elizabeth's Cancer Center in Edgewood, Kentucky. I am an assistant professor of medicine at the University of Kentucky's College of Medicine. I'm joined by Karine Tawagi, who is a medical oncologist at the University of Illinois Cancer Center and a GU expert. She is also an assistant professor of medicine at the University of Illinois College of Medicine, and also joined by Karan Jatwani, who is a third-year oncology fellow specializing in GU-oncology at Roswell Comprehensive Cancer Center in Buffalo, New York. Thanks for joining us, guys. Appreciate your time, and I'm ready to talk about prostate cancer 101. So our outline for today, we'll be talking about some definitions about what is prostate cancer, what are the risk factors associated to developing prostate cancer. Diagnosis-wise, what is a PSA level? What does that mean? What is a Gleason score, and how does that correlate with the prostate cancer? And then what are the stages of prostate cancer? And then finishing out on treatment and monitoring. How do we treat prostate cancer, and who are the other specialists involved in this journey? So I think we should start out, just with basics and talking about, what is the prostate, what's the function of the prostate, and how does cancer start within the prostate? So, Dr. Jatwani, can you comment on this and talk about, what's the normal function and how does cancer form?
Yeah, so prostate basically is a walnut-sized organ right below your bladder, and it resides between your bladder and rectum, and this is where the pipe that transfers the urine to the from the bladder to the penis passes through. So prostate just resides there, and most of the times prostate helps with the sexual function. It releases some important chemicals that help maintain your sperm health. And this is the main sort of function for prostate. And, whenever, because of different reasons that we'll probably go into, sometimes what can happen is right where the the tube that goes from the bladder to the penis, from the prostate goes, this is where the cancer can sort of start to brew. And one of the early signs that the patients can expect or see sometimes is, changes in their bladder habits. So it can either be a normal increase of prostate function, uh, a normal increase of prostate tissue, which we call as BPH, but sometimes it can be cancer as well. So as you have rightly noticed in the other slide, the cancerous tumor can brew inside the prostate. So yeah, that's the basic function, how we look at prostate.
Talking about some risk factors for prostate cancer, I think that, people over the age of 50, African American men are known to have an increased risk of prostate cancer as well. And then, those with a family history as well. So really, people that have a first degree relative, a son, father, brother, someone that has been diagnosed less than, the age of 55. And then, patients, that have family members with other cancers that are not prostate cancer. So breast cancer, ovarian cancers, and pancreatic cancers can sometimes be linked to what we call hereditary genetic mutations that may increase the risk of one developing prostate cancer. And I think the one that comes to mind, I think, is the BRCA1 and 2 gene that is really more well known, I would say, more in breast cancer, that a lot of people know it a little bit more about it. And I think that as a result, if someone has a BRCA1 or 2 mutation or other sort of similar genetic mutations that may increase the risk of cancer, these genes can be passed down and increase that risk of cancer. And then there are also potential treatment options available as a result of knowing this information as well.